It's Monday, the 1st of November 2021. It's time for the local news for today. Good morning, my name is Janine Wilfrid. In today's news, Kidney Dialysis Center for Children opened, 200 persons vaccinated on first Vaccination Cluster Day, bodies of COVID-19 patients dumped in refrigerated containers, and G20 countries will distribute vaccines to less wealthy countries. The Kidney Dialysis Center for Children in the St. Vincentius Hospital is officially inaugurated on Thursday. It is the first facility for young kidney patients in the Guyanas. Werner Keinswijk, pediatrician and nephrologist, has been with this project from the very beginning. Thursday, one of his dreams for children who have to dialyze was accomplished. They no longer have to sit among the adults.
We have about 5 to 10 children on dialysis every day or every week at any given moment in Suriname. That is about 15 to 25 in a year. And why is it 15 to 25 in a year and not 15 to 25 every day? That's because children, in contrast to adults, most of the time have causes of renal failure, of kidney failure, that are transient, that eventually disappear. They need dialysis most of the time for a week, a month, 2 weeks, and after that they're good. But if you don't have the option to dialyze them, they die within that week, they die within that month. And so this is why it's important to understand why we have such low numbers, and that this is essential to understanding the problem.
Keith Johnson, Managing Director of Republic Bank, explained why the bank found it necessary to fund this project. It took a long time for the project to start. The COVID-19 pandemic has caused many delays.
This project began during the past year, and I pause here to applaud our management, and in particular my predecessor, for the foresight in identifying this as a worthy project to be undertaken by the bank. I also recognize the wisdom of our supervisory board for their sanctioning of this project at a cost of US dollars 131,000. When you convert that to SRDs at today's rate, it is quite significant. It's over 2.7 million SRDs.
This is a good step for healthcare, preventive care at an early stage. With this center, we can extend the lives of our children, says Public Health Minister Amara Madin. More than 200 people have been vaccinated at the Anton Resida School last Friday. It was the first Vaccination Cluster Day of the Minister of Education, Science and Culture in collaboration with the Ministry of Public Health. Director of Education, Gracia Faliz Omskerk, took her first shot on Friday. Due to her own experience with COVID-19, she decided to get vaccinated. The students, teachers, and parents have been able to prepare well for this day. According to the school principal, Farid Bolay, all parents and students were given the opportunity to ask questions about vaccination. With Friday's action, the majority of students will be vaccinated. Vaccination Cluster Operation Manager Sandhya Ramnarayan indicates what she thinks of the emergence and design of the vaccination campaign. Education Minister Marie Levens indicates that this project will be further expanded throughout Suriname. It is unimaginable and reprehensible how people deal with the suffering of others this way. So says Javier Asin, coordinator of the National Coordination Team, NCT, during the most recent COVID-19 press conference. For several days, images have been circulating on social media of corpses in refrigerated containers on the site of the Wanica Regional Hospital. According to Asin, this situation could have been prevented if people had been vaccinated against the coronavirus. Then there would be no need to use refrigerated containers as morgues. The number of deaths from COVID-19 is decreasing, but there are still many infections. Patients who are nursed in intensive care units have mentioned in separate conversations that they regret not getting vaccinated earlier. G20 countries will distribute coronavirus vaccines to less wealthy countries. The aim is to have vaccinate more than 70% of the world's population by 2022. This decision was made during the G20 summit that was held on Saturday and Sunday in Rome. At the meeting of the largest industrialized countries, there were discussions on climate change and the COVID-19 pandemic. Health Minister Amar Ramadan indicates that the goal of the G20 countries have previously been established by the World Health Organization. The WHO member countries were called on to provide other countries with vaccines. Suriname is already working on this, the minister said. Every country aims for a minimum of 70% vaccinated. However, not all countries can respond to this because they do not have enough vaccines at their disposal. Ramadan hopes that through the appeal of the G20 countries, the international goal can be achieved more quickly. After all, it is the richer countries that are now using the stocks for booster shots for their populations. The doses can be used differently if they, like Suriname, choose who urgently needs a third vaccination. Suriname aims to have more than 70% vaccinated by the end of the year. Until yesterday, more than 51.78% of the population has been vaccinated against the coronavirus. And these were the local updates for today. Thank you for watching. Tomorrow we'll be back with more. Have a nice day and stay safe. Goodbye.